Today we are here with Mike Hensley, managing partner and co-owner of Burgess Square Healthcare and Rehab Center. Mike, how did you get started in this profession? Was there a specific person or event that made you choose this career?
You know, really, how I got here was very organic. I put my way through college stocking shelves in a hospital. And so when you do that after a number of years, you actually learn about healthcare through the items that you're stocking. And after college, a friend of mine, his sister worked in healthcare and worked in skilled nursing, and said that I would be a great admissions director, which I had no idea what that was. And I was either a choice between grad school or giving that job a shot. And over the last now over 25 years, just aspired to do better in everything I was doing. And it really got in my heart, making a difference in people's lives, and doing the right thing really turns out to take care of you in the end.
Well, speaking, your center, Burgess Square, recently won a Gold Quality Award.
Yes, we did.
What did your center achieve or change through the Quality Award process?
You know, the most important part about the Gold Award process is the cohesion that it facilitates through your staff and the departments. There are, of course, specific quality objectives that you are meeting and QAPIs that you're doing, but when you do that, you're doing it cross disciplines, cross departments, so it fosters better communication with your staff. It makes everything better, even things that you're not measuring. So that is one of the biggest things, is the staff cohesion with each other.
Really building that teamwork.
Well, even recently, my therapy department took their initiative. You know, we're beyond gold, we're in a lot of challenges, but they took an initiative to create a falls prevention program. Now that usually falls underneath nursing purview, and therapy took it all upon themselves and began this fall prevention program because this is the kind of thing that is instilled with the quality award process. It continues on.
Wonderful. Now, from a provider perspective, what are the biggest challenges that are impacting quality care and the profession right now?
Well, everyone is going to stay workforce and staffing. And it is true. But that and other challenges are not ever going to be fixed unless there is a change in culture at the regulatory agencies, CMS, HHS, until they have a different perspective and view and value skilled nursing care. None of our many challenges are ever going to be fixed, and that is one of the most difficult things doing this. I mean, I know that I've had a lot of experience being able to be in communicating with governmental agencies and even ACA and all their work. And I'm naive to a lot of the policies and a lot of the policy makers, but I think that the naivety of the people who are making these decisions for the industry, who aren't on a floor and aren't answering a call light and aren't working hand in hand with nurses, that's more naive and more detrimental.
Absolutely. On the flip side, what do you see are some of the bigger opportunities right now facing quality care and the profession overall?
I think that the biggest opportunity is to actually have CMS and CMMI engage with incentives for the skilled nursing profession. It's difficult. There is a 30-day all-cause readmission that is either a penalty or an incentive. It's all-cause. The variability across our industry is dramatic, and the variability in the patients and the things we do, and to put a blanket all-cause 30-day readmission is back to naive. And I really think that the incentives, I'm lucky. John and Anthony and I, my co-owners, we grew up at low levels in healthcare, as I said earlier, and we have the same values. And so we always want to put patients and our staff first. But there are other providers who need incentives. And unless they start actually incenting with real incentives the skilled nursing profession, right now it's all with the insurance companies, and all the APMs go towards hospitals and physicians. And you have providers that are trying to survive, and if they don't have any kind of incentive to help them survive, they're going to run away from these programs.
Some harsh truths there.
Sorry, yeah.
What do you wish the public would know about the work that happens in long-term care?
That there's really, really amazing people doing amazing things every single day. And that is the most difficult part, because I see quality, I see love, I see so much care in facilities, but unfortunately they get drowned out by the negative stories that are pervasive. But the good things that are happening far outweigh those negative stories, and we're easy targets and easy tropes for if the newspaper has open space or agency wants to score points. I think that really if people were in the facilities seeing what is happening every day, that they would know that there are really great things happening.
Absolutely. Sometimes it's easier to focus on the negative than to spotlight the good, but so important.
Unfortunately, yes.
So important. Well, thank you for being with us today and talking more about quality care. I appreciate it.
You're very welcome. Thanks a lot. Thanks for having me.
Absolutely.